Hey, Ansley here today with my friend, Michael Davidoff, Senior Vice President at Phreesia. Michael, good to see you.
Good to see you, Ansel. Thanks for having me.
You bet. You bet. Listen, I know you guys have been out in the trenches working with clinics and hospitals during this COVID-19 outbreak. Kind of give us an update of what's going on with you guys.
Sure thing. So Phreesia's clients are large health systems and ambulatory groups and hospital systems all across the country. So we have clients in every state. And what we do is manage the patient intake process. So we build software that essentially replaces the patient clipboard. So instead of a patient coming in and using a clipboard, they use their mobile device to capture what you typically would. And then we take that information and put it into the electronic medical record. So we have a system in place to capture information from patients. And so in February, our clients were reaching out to us because they wanted to start screening for COVID-19 risk factors, specifically exposure risk and symptomatic risk. And so they wanted us to start screening this so that they could develop protocols and make decisions before the patient actually came into the health system or the medical practice. And so basically what we saw in February was about 70 clients take this up. And by the end of March, we had over 700, right? So obviously things have changed dramatically. March, we really started seeing operations be disrupted, right? Because they had to start rescheduling patients and canceling appointments, right? And ultimately, figure out ways to operate after you eliminate the waiting room. Now what we're starting to see is some stabilization now that groups are getting their telehealth systems up online, right? And figuring out how to operate in these new environments where you can't be face-to-face.
Well, how has this impacted Phreesia, and how have you responded to your clients?
So Phreesia is a product company, right? And so we've responded by shifting tremendous resources to making sure that we are able to service our clients in this current environment, right? And so this current environment demands that we help them reduce exposure, right, between patients and staff, and keep everybody safe during the intake process. That's our job. That's what we do.
Right.
And so as they've eliminated their waiting rooms, you have to figure out new workflows. We have some organizations, whole health systems, that have shifted their whole registration staff to work from home, and they'll use Phreesia from home and basically capture all the intake information from patients remotely on their mobile device. Other organizations are trying to figure out how do you support alternative care settings. So you're reading a lot about drive up or drive-through clinics,
right?
Triage tents, and so they need what they're asking Phreesia to do, and how we responded is essentially, after we've screened patients and figured out are they symptomatic or asymptomatic, or figure out what their risk level is for COVID-19, then we're triaging those patients and sending them to different locations. A sick location versus a well location is typically what we're seeing. And I'd say the last thing that we're doing is we're trying to support them as they scale telehealth, right? So these telehealth projects would have typically taken 1 year to 2 years easily at a health system. They're doing it overnight. And so what we are doing is, even if you're doing telehealth, you need to intake patients.
Right.
And what we are doing is initiating that intake right before the telehealth visit, and trying to automate that process to make the shift to telehealth easier, so that health systems and medical groups can continue to see patients in this low exposure environment.
Listen, thank you so much for taking time. I wish you the best and much success as you help healthcare during this extraordinary time. Hey, and if you'd like to get a hold of or like to know more about Phreesia, you can go to phreesia.com. And or if you would like to reach out to me, please reach out to me and direct message me here on my media. Michael, thanks so much today. I wish you well. Stay well.
Thanks. You too, Ansel. Take care.